webinars we try to run webinars every month. What we're going to do in this webinar today is run through both of our products. We have two core products for EMIS, and we have one core product for System 1 at the moment. We will be releasing a second product for System 1 later this year. So what we're going to do is we're going to go through our normal pathology management platform first. As you should be aware, it was sent out in the confirmation email, because that's obviously for System 1 and EMIS practices. That tooling works with both, and we'll spend maybe 20-25 minutes on that product, and then after that we will spend the remaining 20-25 minutes on our hang on. Oh, can you hear me?
Yes, sorry, that was me. I was just muting everyone.
Okay, so I'm not sure where I got to. So I can see a question coming up. Could you pop questions into the chat, please, and then we'll circle back to those in a moment. So essentially what I was just saying is we're going to run through our pathology management platform first in the first 20-25 minutes, and then in the second 20-25 minutes we'll run through our Docman automation platform, and we'll circle back and ask questions on both at the end. We like to keep our webinars interactive. So if you have questions, or please pop them into the chat. What we will do is we will stop and we'll circle back and answer the questions, and then carry on with the presentation periodically throughout the webinar. Questions are important, and we welcome them, so please do pop them in the chat, and if we can answer them in the webinar we will, and if we can't, we will come back to you. I've seen an accidental hand came up. Thank you. Okay, brilliant. Right, so what I'm going to do now is I'm going to share my screen. Sharing now, and we're going to run through our pathology management platform first. Okay, so you should all be able to see that. Okay, so who are we? Actually, let's do this in a slightly different way around, because this is relevant for both. We are JIFJAF is the company name. We have a brand of products called MyBotGP. Our pathology management platform is classed as a medical device. Obviously, we've got DCB 129 certifications. We've got DCB 160 templates we share with all clients. And we're also fortunate to be an NHS ICT partner, which is quite unusual for a private business. So it's important to explain what that actually means. We are a private UK business. However, we are in a fortunate position where we are an NHS ICT partner. And why that's fortunate for us and our clients is it means that we have access to NHS cloud. So all of our kit is NHS cloud compliant. So stuff like DTACs, DPIAs, data sharing agreements are not an issue for us. We can literally plug you in. Okay. So bringing it back to the reason why you've jumped into the call, our pathology management platform. And again, Farrell, please keep an eye on the questions, and then we'll circle back and we'll answer those questions for you. So what's the principle behind this tooling? Well, the principle behind this tooling is you're all extremely busy, and you're doing a massive amount of work. And quite frankly, a portion of that work now can be removed through automation, and an automated platform that replicates what you would do if you were doing that task manually. Doesn't try and invent something new or find a new way of doing things. It essentially replicates what you do manually, and it does it for you reliably, robustly, securely, and it can evidence that as well. And this is what this platform does. It's here to help free clinical time, enforce rules, reduce errors. So the front page of this, obviously, as you can see, says stop losing clinical time and headspace reviewing normal pathology tests. MyBotGP for both System and 1 intelligently automates the normal result review, patient contextual checks and filing. Safely filing appropriate results while flagging those that require clinical attention. So what are we saying? We're saying that you apply for thousands and thousands of pathology tests a year, and we have a numbers calculator where we can actually show you how many path tests you're applying for. And the labs take responsibility for the path test. So they don't take responsibility for the same way, obviously, as you do for the patients. Their job is to evaluate the pathology test and send you an accurate reply to the pathology, an accurate reports, the pathology test, either using keywords, either using warnings or ranges, or a combination of keywords, warnings and ranges. But they all come back to you, and then you physically look at each one and make a decision as to what you want to do next. And a large proportion of those can just be filed because they come back as normal, and a large proportion may come back as normal from the labs. However, you might not want to dismiss those path tests. You may well want to go into the patient record and check for health conditions, percentage increases or decreases. You may want to supersede the lab ranges in terms of age or gender or specific ranges to see more or less tests. And this is something that you're doing manually at the moment. And MyBotGP will take full responsibility for this. It's a fully automated platform that works 7 days a week, 365 days a year. It's a super robust platform. We're now touching 3.8 million patients with this platform, and we're processing thousands and thousands of pathology tests a day nationally. So it's here to free time, enforce rules, remove errors, and enforce standardization at practice level if that's what you want. Now, current time savings based on client feedback, up to 30 minutes per day per clinician. And we'll explain to you what that means, and it frees time up to do other things. So this essentially is a sample business case. So an 8,500 list, let that person in. So an 8,500 list will receive approximately 62,400 pathology tests a year. Okay, that number is pretty accurate. So that's 8,500. So what we're saying is a practice of half that size will receive half, and a practice double will receive approximately double. So that's quite an accurate benchmark. 8,500 list, 62,400 path tests hit your practice per year. It's a continuous clinical workload. Now, approximately 80% of those pathology tests come back as normal. And just as we were saying before, the lab's responsibility is to give you an accurate result on that path test. And if that path test comes back as normal by means of sending you within range or keywords or a combination of ranges and keywords, that's what they do. And they all hit you. It's a continuous clinical workload. Now, that actually accounts in this scenario for almost 50,000 pathology tests a year. So practice receives 62,400. You're getting 49,920 coming back as normal. Obviously, not all of those can be filed. A lot of them can be auto-filed, which is what this platform will do, but a percentage of them won't. And that percentage is somewhere in the region of 20. So 20% of that 49,000, almost 50,000 path tests, which equates to almost 10,000 path tests a year, you're running manual patient contextual checks on, or you would like to run manual patient contextual checks on. So what we're saying by that is it comes back from the lab as normal. However, you want to go into the patient record and check for a health condition or a percentage increase or decrease, or you may not agree with the lab and want to set your own ranges. And MyBotGP will do that for you, fully automated in the background, so you don't have to do that anymore. So the output, what it means is that when you look in your inbox, you're only going to see pathology tests that you want to see. They are either abnormal or they're normals that have failed a patient contextual check. There's an enormous time saving. Coming back to safety, enforced protocols, nothing slips through the net. You can reduce the variation in approach to evaluating pathology tests a year. Now, GP practices in the UK, and I'll cover the rules in a moment, and then we'll stop for questions, and I can show you examples as well. But obviously, the way GP practices are set up in the UK, you are businesses, and clinical cost capacity is a cost footprint. £50,000 a year is roughly what it's costing this practice in time and clinical costs just to validate their normals. And we'll circle back to that in a moment. So path tests sit in 4 buckets. They arrive at the practice. Normal, you don't need to do anything with it other than file it. MyBotGP will do that. Normal, but needs a patient contextual check to decide whether that can be filed. If it passes the check or if it fails, it needs to be left for the clinician. MyBotGP will do that. Do you agree with the lab and want to set your own ranges? MyBotGP will do that. Most of our clients supersede lab ranges for things like full blood count, prostate, lipids, EGFRs, any number of different tests. Our kit, MyBotGP, can now look after over 220 different pathology test types. That's pretty much all path tests nationally. 220 path tests, and that's important for a tool like this because it adds value when it can cover volume. can't, you've got to be able to cover all of your path tests to be able to get the volume in to make the business case. Ensure safeguarding, decides what needs to be filed, flagged, and it can also send text messages to patients using your existing setup, be that System 1 or Accurix if you're using System 1 or EMIS. All of your filings and comments and links and all of that type of stuff will remain the same if you want it to. Nothing has to change. So these are the rules. And you can use these rules in combination, and we'll give some examples and we can show you a spreadsheet as well, which hopefully you will have received in advance of joining the webinar today. It will have been sent by my colleague. So 100% of test types can be added. That's over 220 different pathology tests can be uniquely managed. Condition checks. You can say to MyBotGP, I'm happy for you to file this path test unless you see a health condition. If you see the health condition, do not file this path test, and it will do that for you. You can supersede lab ranges, as we said before. You can check for a health condition and supersede a lab range. You can check for a previous test result for a percentage increase or decrease. But MyBotGP will do that for you, and anything that fails will be a fail, and anything that passes will be a pass. You can supersede in terms of age and gender. MyBotGP can also read the words on a pathology test report. So we are not limited to only processing path tests that have ranges only. That's important because you'll get up to 10 different path test types a year that use words: detected, not detected, positive, negative, bacteria, whatever the keyword is. And those 5 to 10 different path tests a year could equate, depending on the size of your practice, to 5 to 10 to 15 to 20,000 path tests a year that are going to run through the platform as well. Again, coping with the volume. You can omit patients in 2 ways. The first way is you can say, I don't want this patient being processed. I want to see it manually. So you can pop in their NHS number. Someone's coming in. And you can also say on test request, if you don't want someone to have their test auto-filed, you can put a code in at test request, and that test will come back and it will be skipped. And that way, if you're applying for a batch of tests for a patient and you want to see the normals come back in, those will still come back in. Now, it's really important to confirm as well that our kit uses EMIS and System 1 in exactly the same way that you do. So it still files to the patient record in the same way. Your comments will still be there. If you're sending a text message, it will all work in the same way. The links, all of that stuff will still remain the same. And importantly, when patients log into their app, they will still see their path test reports filed in the same way. Most of our clients set up a generic username, the name of their practice, call it the name of their practice pathology team. So it could be Green Surgery Pathology Team, for an example. And they have a username and password, which is allocated to that login for System 1 or EMIS, only has permission to look at path tests. And then it will file against the patient record with that name. And obviously patients can get path tests, SMSs as well. So here's a bit on the configuration. The configuration is pretty straightforward. We do it for you. It comes pre-populated, and then we log in with you and supersede any path test where you want to bespoke them for your protocols, for your practice, and it doesn't take long at all. And we do that with you. We have an open door policy here for clinical calls with regards to configuring this tool. Some clinicians want several calls. Others don't. Others are happy with the couple. Others don't want any. So we will follow your lead. Invariably, about an hour to bespoke the tooling. And what you're looking at here are very simple drop-down buttons and columns where you can add words into bespoke. So in this example, a liver function test has come through with these ranges. You'd look at that and say, am I happy to file this liver function test with these ranges? If you are and you don't want additional checks, we would click File for Normal Reports. It will come up with a warning saying, are you sure? If you say yes, then the next time it sees that path test, it's going to file it as long as none of the ranges are failed. Now, or you could get these ranges back for a liver function test and say, no, I don't like that, or I do like that, but I want to add additional functionality or additional checks. And here's where you can quite simply just put a new range Prostate is an example. Most of our clients supersede prostate, set different ranges and lipids and stuff. But I'll show you examples in a moment, but you can set a new range. Or here you can say, I want you to check against the previous test result. You just click yes for a percentage increase or decrease. Here, look for a keyword, present, absent, or in the problem page. Now, this is really important because here you can add keywords in, and those keywords can relate to patient health conditions. They can also relate to warnings on the lab reports, and they can also relate to results on the lab reports. And this is where you would write in something like, I'm happy to file this path test as long as this patient doesn't have, and you write the health condition. And you can cluster up the health conditions and write multiple health conditions in. And when we configure the tool for you, we have all of this pre-templated as well. We've got examples nationally of what different practices have done. Okay, comments and filing strings are here. And obviously you can supersede your existing ones or they remain the same. So what I'm going to quickly show you now before we go stop for questions, and then what we would do is we'll circle back for questions and then we can go into pricing and stuff. This is one of our clients. They have let us, basically, we've downloaded their rule set from MyBotGP, and they've given it permission to look after 181 different pathology test types. And these are the 181 different path test types that they've given it responsibility to look after. And you can see the rules and the ranges and the keywords to look for and the comments and the filing strings that they've added. Now, this is an indicative example that you would have had a copy of. So again, just to caveat that, if you have a different approach, that's not a problem. This tool is easily bespoke to practice level. So just by example, what I'm going to run through here is a couple of examples of what they've done. Now, I don't want to overcomplicate this because obviously this kit is going to file thousands and thousands of path tests a year safely for you that do not require additional checks. So let's take it that that's done in the background, fully automated, which it is. What I'm going to do now is just show you a couple of examples on how you can lock down the logic to file or to add additional checks over and above what you just want filed. So this is a sodium test here. This particular client, their lab sends it at 27 to 287, and hopefully you can all see the spreadsheet. For them, they don't believe that superseding the range, they don't want to add age or gender superseded checks, and they don't believe checking against the previous test result will add any value. However, the value for this particular client is they do want MyBotGP, and if you look in the keyword section here, which is showing in the top left-hand corner, they do want MyBotGP to look in the patient record, and it will do this for both EMIS and System 1 and see if the patient has diabetes or chronic kidney disease. And if it does find that health condition, they don't want that path test filed. They want it left for clinical review. That patient left rather for clinical review. So that's an example of the keywords. And as you can see, keywords are very, very popular. They're used right the way throughout the platform on multiple different path tests. So the other example that I'm going to show you now is just how you can combine logic. So by example, this client didn't agree with their lab's prostate ranges. So they've superseded their PSA test results on receipt. What they've done is they've set up 5 age ranges. Most clients set up either 4 or 5, and you can see the age ranges here: 18 to 39, 40, 49, 50, 59, 60, 69, 70, 150. And they've said 2.5, 2.5, 3.5, 4.5, and 6.5. So saying, ignore the lab. We want to use these PSA ranges for these ages, for these age ranges. And the safety as a default check, look in the patient record, and if they've had prostate cancer or metastatic prostate cancer, don't file it. So invariably what they're doing is they're using the keywords and superseding age ranges to make sure that nothing slips through the net and they only see what they need to see. HbA1c is another example here. This particular client, they are using the range 20 to 41 that comes from the lab. However, they want MyBotGP to double check patient record and the path report for any warnings or anything that relates to diabetes or pre-diabetes, and it will read both. And if it sees anything, it will not file it. Okay, and then we have obviously we have another lipid example here. Again, this one is a bit of overkill. but we leave it for examples, just for an example purposes to show you can use collections, combinations of, actually one here, of keywords. Most clients supersede some of the cholesterols and lipids, and invariably, well, it's the wrong one each time. Yeah. And I have a combination of keywords here. Yeah, and you can see the keywords. I mean, and we've put all the keywords in just so you can see, or this client rather put all the keywords in just so you can see any combination, but most put CKD. Okay, so if we move back to the presentation now, super easy to configure, which we configure for you. It does come pre-populated and doesn't take an enormous amount of time. And again, we'll share this information with you afterwards. Here's some more on the business case. 1.5 days a week, 95 days a year. Time adds up. That's costing this 8,500 list, £50,000 of clinical capacity that could be allocated elsewhere. 220 different path tests. Okay, pricing is pretty straightforward. We can send you the pricing afterwards, but invariably it's list times 30 pence plus 749 and then 5, 6 or 7p, depending on how many patients you have. Okay, so I'm going to stop sharing now, and I'm going to look in the chat. I can see some questions. That's fantastic. All right. And we'll go through these questions. We'll spend about 5 minutes or 6 minutes on these questions. And then what we'll do is we'll jump into the Docman automation tooling. We'll do that super quick, up to 25 minutes or so. And then if we've got time at the end, we'll circle back for both products and any questions on both products. And again, if anything's not answered now, we can circle back and answer that to you afterwards. So first question is around hemoglobin of 13 is normal, but if it's dropped from 16 to 30, it's not normal. How will your system flag that? Reports such as sputum sample, etc., how will it get flagged? So again, with hemoglobin, if you wanted to set a default, if you wanted to set a rule in there to say file this unless it hasn't gone down by a certain percentage, if it has, flag it. But again, this tooling is to pick out normals. So think of the logic behind this platform is to pick out your normals and to spot the abnormals and leave them for your review. But in principle, you can say happy to file this unless it's changed by a certain percentage, increase or decrease. The next question looks like it's semi-linked to that. Does the filing take into account previous results? It can do in terms of a percentage increase or decrease. For PSA, would it check for medication like finasteride? Good question. If that's in the problem page, yes, you can manually put that into the problem page. We do have some clients that do that. I've got another spreadsheet of rules where they have included that, and they've manually added in finasteride into the problem page, so MyBotGP will check for that as well. How can you tell it to work with different ranges with different conditions? Not sure I understand that one. If you could pop something else in the chat, we can circle back to that. This tooling, if I understand correctly, is here to pick out rules based on the path test result, and then you can put in a list of health conditions that mean that if a patient has that health condition, it won't file that path test, and you can just list them out. I think that's what you mean. So you can write multiple health conditions. Hopefully that answers your question, Helen. If it doesn't, please let me know. Can we have the cost page back up again? Yes, I will bring that up in a moment. I can't read the questions at the same time. Farrell, will you note that one? Can you set patient-specific ranges for PSA? No, not yet. We will be launching an abnormal product next year. For safety purposes, this platform has to have a very clean identity, and it is here to pick out your normals and flag your abnormals. Farrell's already got that one. Okay, we'll share deck after the practice. How much is the... so one's asking for practice, one's asking for a quote. Great. For example,
James, next question was a follow-up from Helen from the previous one. So for example, cholesterol range is different if primary or secondary prevention.
Okay, yeah, I've just got to that question now. Thanks, Farrell. Okay, for example, cholesterol ranges if different for primary or secondary prevention. Again, I'm not 100% sure. If it's a different path test, if they're coming through to the practice, so we do have some clients that get same path test in different formats from different labs. They've got different ranges and different keywords associated to them. They can be looked at individually. I think that answers. If it doesn't, we can circle back to that. Does it leave a sticky note, or has it left a sticky note? Example, drop in HB or use set. Does the clinician have to figure that out? No, we are going to be adding some functionality to it shortly where it will flag. At the moment, it leaves the path test in there, and it will have a marker added to it fairly shortly. Okay, so Helen, if that doesn't answer your question, let's circle back to that afterwards. I'm happy to jump in, but I believe what you're asking is if we're receiving the same path test from different sources, can they be looked at individually? If that is what you're asking, the answer to that is yes. Just in primary care setting, notwithstanding secondary care, which you've mentioned, we do even have some clients that have got 2 labs, and we've even got one that's got 3 labs. And fortunately, the labs actually use different ranges and have different keywords, so they're treated as different path tests. Let's grab a quick coffee. Okay, so what we'll do now, we will share the recording as well. I'm going to close this down, and then we're going to move to our Docman automation. Okay, so as before, the pathology management platform works with both System 1 and EMIS. This platform only works with EMIS, and you must be using Docman for this platform to work. We will be launching an equivalent for System 1 later in the year, and it will follow the same format. So when we rather describe this product, we think it's very important to tell you what it doesn't do, because it's only when you understand what, because we think it's quite confusing in the market. There's lots of different companies saying they do all manner of different things, and it can become quite confusing. So what we want to do is tell you the limitation of the tool so you understand its strength. Okay, so there's only one tooling available at the moment which can take responsibility and ownership for a patient and process a letter and clinically code that letter and own that decision and take responsibility for the welfare of that patient. And that is a person. There is no AI that can do that for you, or yet. It's coming, maybe 3 to 5 years. There are some very, very expensive tools which will have a guess, and then they give it to a person to make a final decision on, because quite frankly, they don't want to get it wrong. And if you get a person to validate that decision, the person takes responsibility for it. And that's why those tools aren't popular. This tool is super popular because it's got a very, very clean, clear format where it starts and where it stops. So this is the scenario, the business case. This 8,500 list unbelievably gets about 125 letters a day. 39,000 a week, 365 days a year. That, again, like Path, that number's fairly accurate. 39,000 letters a year got to be got onto the system. And the reality is a lot of those letters don't even really need to be seen by someone, but someone has to see them to confirm they don't need to see them. Quite similar to Path. You know, why on earth would you have clinicians looking at Path tests to confirm they don't need to look at them? Well, it's just a waste of time, and you know, technology's moved on, so you can be supported now. So in this scenario, you've got 125 letters a day. This is the process that people seem to forget about. 125 letters a day need to be validated against the patient. So patients leave, letters arrive incorrect from the hospitals, NHS numbers are incorrect, patients are no longer with the practice for other reasons as well. So that's a check that's done by the team 125 times a day. Someone then, or a group of people then, have to quickly and accurately extrapolate that letter into a Docman template. That's being done 125 times a day. Now, IntelliSense will have a guess, but it doesn't commit to the decision. So you have someone looking at a letter and a template simultaneously trying to cut, paste, namings and titles and dates and stuff. Manual task. That's a manual task. Someone has to file 125 letters a day against the patient record. It takes time. Now, a large proportion of those letters need to be actioned or routed. What do we mean by that? Well, thousands and thousands and thousands, maybe 60%, 50% of those 39,000, maybe that figure's higher, don't even need to be seen. They just need to be filed against the patient record. So you've actually physically got people validating patients, completing templates and filing letters they don't need to see, their practice doesn't need to see. And then the remaining percentage of letters need to be seen, and they need to go to the correct person or folder or set a task or set a template. So every practice in the country has its own flow on what they do with letters when they receive them. Obviously, it's quite similar, but they are quite unique as well. So what you do with a letter that needs to be seen, one practice might say, well, for that letter, what we do is we create a task or we put it through a template. Another practice might say, well, for the letters we need to see, we've got a coding team that's capable, so we give it to the coding team. Another practice might say, well, we triage to usual GP. Another practice might say, well, we give them all to the coding team and they're allowed to make decisions to a point, and anything over that point, they send it to another person. All of that piece is completely replicated by our tool. We don't touch it, so you don't have to panic that what you do with letters changes. MyBotGP basically loves using Docman. It's a Docman super user, and I'll run through the process of what it does. It's on 7 days a week, 365 days a year. It's going to get your letters it will file all of the letters that arrive that day, every day. So you're not going to come in and find a whole bundle of unfiled letters. Doesn't matter if people are off sick, away. We still need the people. Obviously, there's a massive work to be done. But this kit will do all of the donkey work, for want of a better word, in the background to get everything onto the system. So holidays, sick leave, recruitment aren't a challenge anymore. Rough amount of time allocated is about 203 days a year for an 8,500 list practice, just on this task. So what does our kit do? As I said before, it's an automated Docman expert that you tell what to do. So anything that you do with Docman and the protocol that you have at your practice can be replicated. So don't panic that if you buy an automated platform, the way that you triage letters around the practice in terms of who sees them, which ones you want to see, which ones you don't want to see, is going to change, and you're going to start to lose track of letters. That
I've come, it's fine.
I think someone's come on. Oh, sorry. I think someone's come off. Yeah, thank you. Okay. Okay. So don't panic that your letters are going to start going awry at the practice, and all of the protocols that you're comfortable with and you've built up over years of practice are going to fall apart. They will remain the same, because MyBotGP will use the tooling will use Docman and just copy it. So if you want to set a task, it will set a task. If you don't want to see a letter, you don't need to see a letter. So think of, if we relate it back to this bit here, what you're actually doing to get these letters onto the system. MyBotGP is going to fully automated pick up your letters directly from Docman and emails. It's going to validate the patient by itself. So that's that manual check done. So in this 8,500 list, that's 125 times it's going to validate if the patient exists and they are at your practice. If they do, it's going to complete the Docman template, fully automated by itself, and it will take responsibility for filing that for pressing enter on the Docman template. So it's going to pick out the right date, it's going to name the letter, it's going to do everything other than code it. Next, based on that letter and what you've told us that you want done with that letter, action, route, and file. So if you say to us, this particular group of letters just need to be filed, we don't need to look at them, it will do that. If you say to us, this particular group of letters just need to be filed, we don't need to look at them unless there's a warning on there, attempted suicide perhaps for a 111, it's going to look for that, and if it sees that, you might say file that, unless you see a warning. If you do see a warning, I want you to create a task or put it in a folder, or however you work, it will do that. So what we're saying is that once we've got the letter validated, into Docman, filed against the patient record, then wherever you want that letter, MyBotGP will send it. So files letters that don't need to be seen, no task. It can triage letters to coding teams or folders, or collect from folders. It can create tasks. It can create letters to usual GP. It will replicate what you do at your practice. So the win from this product is you've now got a machine, a fully automated machine, that's quite happy to sit in the background 7 days a week and grab all of your letters, validate all of the patients, get everything into the Docman template, file the Docman template, get the right names, the right dates in the right place, all of that stuff, file everything against the patient record. Anything you don't need to see, you won't see anymore. Like, for example, pharmacy letters can be put in a pharmacy folder or whatever you want, and they can pick them out from there. And the remaining letters will get to the people who need to see those letters. So yes, they will still have to make decisions on them, but they won't have to do anything else. And there'll be no more queues because everything will get dealt with that day. Keywords, as I touched on quickly before, are really important as well. So letters will have warnings on them, as you know. And, you know, and a basic example of that is a 111, as I touched on before. You know, most clients say, don't need to see this 111 file against the patient record unless you see this combination of words or these warnings on this letter, then we do want to see them. Suicide or attempted suicide are examples, then we want those going over here. And then one practice might say create a task, another one might say put it in a folder. It just depends how you're set up at practice level. We have some clients who like to use this tool and keep things super simple. They have 2 folders, file everything they don't need to see, and then have an urgent, non-urgent. We have other clients that set up multiple folders in Docman for each letter type. We've got some that triage usual GP. Everyone works how they work, just dependent on how they want to work. It's really, really not a problem. So the certification around this tool is very similar to our pathology management platform, obviously, which works with EMIS and System 1. We have a DCB 01 certification. We have a DCB 0160 as well, which we give our clients. NHS Cloud compliant, so we can literally plug it in. And obviously, we were a Health Innovation Network Launchpad program, one of the old AHSNs several years ago when we first started. Super comprehensive reporting as well. And it's the same principle with pathology. This type of tooling must have and does have very comprehensive reporting. So at any time, you can see what letters have been filed, haven't filed, volumes, dates, days, and the same with the pathology test management platform. All path tests that have been touched, you can break that data down for auditing purposes. Pricing on here is very similar to our pathology management platform. That's an additional £1,200. So this 8,500 list is coming in at 5,137 plus VAT. And again, we'll share pricing. And if you want to quote, let us know, and we'll send you quotes and stuff after the webinar. But in principle, this would be base subscription 1,999, list times 30 pence, and then plus 7, 6, or 5 pence, depending how many patients you have. It works out 5,137 for an 8,500 list. Okay, so what I'm going to do now, I'm just going to stop sharing for a moment. And I'm going to pull up the questions again. We'll run through the questions. Let me just see.
To assist you, James, Helen did send a follow-up for pathology, the last question. So she said, no, same source, but cholesterol targets are different for different patients.
Yeah, we'll circle back to that after as well.
Yeah,
no problem. Yeah, I mean, essentially, yeah.
Yeah, so I just gave an answer and said you can do it ranges per test type, but you can compare it to a previous test to see if it went up or down percentage, or set a keyword to look out for on the problem page.
Yeah, I mean, they'll be omitted because the person's had a heart attack. But yeah, okay, cool. Thanks, Farrell. So we bring back to Docman. So have you got data on Docman's efficiency, data on reduced errors compared to human workflow? Yes, we do. We have multiple references for this tooling as well. We've actually got a fantastic reference from one client who said it took a bit of time to get their head around the logic on it. Once they did, they actually use it as an example for training new people joining the team on how they can differentiate letters and where they send them. Does it reduce the workload, the workflow volume for clinicians and pharmacy teams? So it depends. That's a two-fold question. If the clinicians are also getting the letters onto the system, then yes, because they won't have to get the letters onto the system anymore. And some are, obviously some aren't, depending on the sizes of the practices and how they're set up. This kit, in that scenario, for Julie's question, what it will do is we'll get everything onto the system. Anything that doesn't need to be seen won't be seen by the team, so that's a significant reduction in time allocation to get the letters onto the system. Letters that need to be seen by a doctor will still be seen by a doctor. Pharmacy teams will pick their letters out and they will still action them in the same way, but they'll be grabbing them from a folder. Okay, we've got Farrell's answer here. Is your software using AI to optically read letters? How is the data stored? Reading keywords, the list for keywords are almost unlimited. Good questions. No, we're not using AI. We use optical recognition. We do not store any data as per DTAC, DPIA. It's all anonymized and it's read at practice level. Reading keywords, warnings, the list for keywords is almost unlimited. To some extent, yes, there are unlimited words, but there are where they're unlimited. There are a batch of keywords for particular letters that will be linked to those letters, like the 111, attempted suicide or suicide, safeguarding words that are linked. And what we do is we actually have a summary of those keywords and we will present them to you when configuring the tool. The way that we configure this tool is we'll suck out all of your letters, we'll put them all on a spreadsheet, and then you'll say, yeah, these letters need to be sent here, these ones we don't need to see, and so on and so forth. Michael has to run, apologies. Can you have the statistics of what will be completed for Docman and Pathology for a practice of 23,000 patients? Yes, we will send you that afterwards, 100%. Do we have any other questions? Please pop them in the chat if we do. If not, what I will do is I'll quickly circle back and do a quick recap of both the products. And then if we have any other questions, we can pop them into the chat. Again, this will be recorded or is being recorded, and we'll share a copy of the recording afterwards and we'll get it onto our website, and obviously the team will be in contact as well. Okay, fine. So is there an ability to trial once you sign the contract? That's a fixed period. Yeah, entry minimum contract is 12 months. Okay, so let me share my screen again. Here are the two products. I'm going to whiz through these five minutes, stop for question, and then 5 minutes, and we'll stop for questions again. So, pathology management platform. Yeah, I mean, the principle behind this platform is to stop losing clinical time and headspace reviewing tests that, quite frankly, a machine can check for you, to make sure that when you open your inbox, you're only looking at path tests that you want to look at. You're not being forced to look at thousands of path tests a year to reconfirm that you don't need to look at them. And that's what this platform does. Significant clinical cost, time saving, and enforced errors, enforced reduction of errors, enforced protocols as well. These are the volumes. 62,500 path tests a year, an 8,500 list. Pretty accurate. 50% practice gets 50%, double gets double. 80 to 85% of those are normal from the lab. Labs don't take patient history into consideration. You do. So what we're saying is 50,000 path tests a year, or what you know rather, 50,000 path tests a year are coming back as normal. Within that 50,000, 20% of those require patient contextual checks, or you might not agree with the labs and you might want to set your own ranges. You're doing all that work manually. MyBotGP will take the lot off your back, and it's going to 220 different path test types. All of them will run through MyBotGP. Every path test that comes in as a normal, it will look at that. If you don't need a patient contextual check, it will file it against the patient record. If you do want a patient contextual check, it will go into the patient record and do that groundwork for you. If it finds any issues, which can be a combination of percentage increase, decreases, health conditions, if you don't agree with lab ranges, you can supersede them. It's going to do that work and make sure you see that path test or not. Fully automated 7 days a week. This is what it's costing, an 8,500 list in clinical cost allocation for a GP, obviously at GP practice level. 220 path tests, which is all of your path tests. We can read path test reports for words as well and warnings, check for health conditions, supersede labs, compare against previous test results, supersede for age and gender, keywords, omit patients, and full safety netting. Patients get sent text messages if you want them to. Everything's filed in the app. This is your platform. You can log in and out whenever you like and make changes. Changes are made in real time, or we can make the changes for you. We generally configure the tool for you. It doesn't take long, a couple of 45-minute meetings, and most practices are pretty much up and running. 95 days a year of clinical capacity allocated on this task, unbelievably. people aren't very good at reconciling how much work they do. 10 minutes here, 15 minutes there, 5 minutes here, half an hour here, adds up. Medical device, DCB 129. We have a DCB 160 template as well. NHS cloud compliant pricing. So stop that and then just stop quickly and see if we have any questions on that. If we don't, then we'll do a recap of Docman as well. So just have a quick look here. I can see Farrell's answering these questions. Thank you. Are there any reductions in cost if 2 or more practices sign up? Yes, there are. Farrell will look after that. Another question. Yep, same question again. PCN purchasing as well. Yes. We've got quite a good PCN model as well, whereby we can configure the tool for the PCN simultaneously. So all practices go live simultaneously. And then in addition to that, if any practices within the PCN want to adjust any of the protocols, then we book a quick call with those, again, half an hour, 45 minutes, and we can tweak some of the protocols at practice level if the practices and the PCN want to do that. We've seen some PCNs are happy to take a shared group of rules and everyone use those rules, and other PCNs might have 1 or 2 practices in there that want to bespoke it a little bit, and that's not a problem. We can do that for you. What's the figures? Julia's got a question. What are the figures again for the PathBot and future predicted cost of Docman? Farrell, are you still on the call, Farrell?
Yes.
Yeah, will you grab that one and get back to Julie after the call?
Will do.
Yeah, brilliant. Essentially, we'll come back to you on that. It looks super complicated, but it's not. It's basically 749 a list times 30 pence, and then depending how many patients you have, it's either 5, 6 or 7 pence. So for an 8,500 list, it works out about £75 a week, which is 3,887, and that's unlimited volumes, unlimited changes, 220 path tests. So I'm going to open up the Docman deck now and do a quick whiz through this. Farrell, is this sharing on the screen?
Yes.
Yeah, cool. Thank you. So, Docman, again, this is the bit that people don't see, or a lot of people don't see. Someone's got to get this 8,500 list. The team have got to get nearly 40,000 letters a year quickly, accurately onto the system. Who's doing that? They're doing that manually. And then within those 39,000 letters a year, there's a percentage of letters that need to be seen by a doctor or a coding team. How do you make sure that they're found quickly and got to the correct people quickly? Well, that's all the responsibility of the people getting all this stuff onto the system. So this is what MyBotGP will take off your back. It's going to validate the patient for every single letter that comes in. It's going to complete the Docman template, which is being done manually. It's going to file every single letter, and it's going to file anything you don't need to see won't be seen, and anything that you do need to see will be sent to the correct person, team, or folder. At practice level, you all have your own flows. I can't emphasize that enough. Most of the panicking comes when people think you're going to buy this tool and suddenly what you do with your letters is no longer up to you, and suddenly we're going to tell you. That's not the case. Whatever you do with your letters at practice level, and every practice is different, it will just be copied. So if you want to create a task for a letter, you'll create a task. If you have one letter that's got one set of wording on it where you want to create a task, and another one that's got different wording where you don't, then it won't. Over 18s, under 18s. Our kit is essentially think of it as a 7-day-a-week workhorse that's going to grab all of your letters, validate all of your letters, get them into Docman, complete the Docman template, fully automated, file the lot so you're on 0 every day, remove anything you don't need to see, and anything you do need to see, you tell us where you want it, and it will do that within Docman. Obviously triage to usual GP or task, no task. Within that, there's additional functionality in Docman we can still take advantage of, like some clients like to hide particular letters and then unhide them. So all of that stuff is still available. You say MyBotGP, file all these safeguarding letters, we want them all hidden. So we'll do that. And then you get to have a look at them first and decide what you want to do afterwards. Nothing will change. as to where the letters will go. What will change if this tool is used at your practice is all your letters are going to get on the system, and you won't have to do it anymore. Obviously, there's a percentage of letters which are incorrect that arrive at the practice, and that will be for the team to cover manually. You look for keywords, and a bit of same pricing as Path, same model, just an additional £1,200. So this comes in for this 8,500 list at 5137, unlimited letters, unlimited volumes. And that's a base subscription of 1999, list times 30 pence, and then 7, 6 or 5 pence, depending on how many patients you have. Again, Farrell and the team will send you exact quotes if you want them to. No additional costs. Okay, so now I'm just going to quickly stop sharing again so I can get to the questions. Let's just have a look and see if there's any additional questions. We can go through those. Okay, anyone got any questions to pop in on either of the products before we wrap up for today? I can just hang on a minute or so and see if anyone wants to pop anything in the chat.
Hi, James. Maybe if you can address Helen's question, just double check if what I sent through is correct. It's just a question regarding pathology. If it's the same source, if you can change the ranges for different patients.
Yes, yeah. For different patients.
Yeah, so different ranges for different targets. So the answer I gave is you can only set ranges for specific test type. For the individual patients, you can only compare to a previous test and look for keywords. Right. That's how you differentiate.
Yeah, that's right. Yes. Yeah. Okay, cool, good. Okay, so if there's no other questions, what I'm going to do now is we will close this off. We're going to save the recording. Thank you for joining us, and thank you for Farrell for helping. And then it'll give us a little bit of time to get this on the system, and then we will share it. The final question: does it ever fail? That's a very big question. Depends on what you mean by fail. Thankfully, we've had no clinical incidents, no patient harm. Thankfully, for both products, and we but if there's a power cut, then it will turn off. We've seen it with other automating software. Yeah, I think I know the software that you're relating to. No, ours is super robust. This is a platform. It's not. Yeah, I think I know why you're asking this question now. Okay, so MyBotGP is very different. It's a purpose-built platform that uses automation. It's not a robot. So what that means is that the configuration can be done, as you saw, with drop-down menus yourself. There's no code to write or anything like that. It's a platform. If there are any changes to the base system, thank you. Yeah, I know. If you've seen it failing, I know who you've unfortunately had experience of. If the systems do change, we can make one change in our system here, press enter, and just like a mobile phone, 1,000 practices will be updated simultaneously. So it's super robust and safe in that regard, just like an Accurix or an Ardens or any of the platforms that operate in the same way. 100%, it's a platform, not RPA. That's a nice way to finish. Brilliant. Thank you. Thanks again for joining. Thank you for your questions. Thanks to Farrell for helping.